Welcome to our video on total knee replacement, or TKR. In this video, we'll explore what TKR is, its causes, precautions, and the surgical procedure involved. Let's start with understanding what TKR is. Total knee replacement, also known as knee arthroplasty, is a surgical procedure where a damaged knee joint is replaced with artificial materials. It's often recommended for individuals suffering from severe arthritis, injury, or other conditions that cause chronic knee pain and limited mobility. The primary causes include arthritis, which can be osteoarthritis or rheumatoid arthritis, knee injury, such as fractures or ligament tears, and overuse injuries due to repetitive stress on the knee joint. Firstly, a thorough medical evaluation is necessary to assess the overall health and suitability for surgery. This may include blood tests, imaging scans, and consultations with various healthcare professionals. Secondly, lifestyle changes may be recommended to optimize outcomes post-surgery. These may include weight management, smoking cessation, and strengthening exercises to improve muscle strength around the knee joint. TKR is typically performed under general or regional anesthesia. During the surgery, the damaged portions of the knee joint are removed, and the artificial components are implanted. The artificial knee components consist of metal alloys and high-grade plastics, designed to mimic the function of a natural knee joint. Following TKR, recovery and rehabilitation are crucial for optimal outcomes. Patients usually stay in the hospital for a few days after surgery for monitoring and pain management. Physical therapy begins soon after to regain strength, flexibility, and range of motion in the knee. In conclusion, total knee replacement is a highly effective surgical option for individuals suffering from severe knee pain and limited mobility due to various underlying conditions. By understanding the causes, taking necessary precautions, and actively participating in the recovery process, individuals can significantly improve their quality of life post-TKR.